current evidence does not support prolotherapy as an effective treatment for sciatica. The American College of Occupational and Environmental Medicine strongly recommends, not only do they not recommend it, they strongly recommend against prolotherapy for radicular pain syndromes. So radicular pain means radiating, like a pain that goes from your hip down your leg, sciatica.
Yeah.
So big no on prolotherapy for sciatica. A yes for knees, tennis elbow, plantar.
Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughan and Dr. Dwayne Vaughan.
I'm going to tell you why I'm doing this show.
Why?
I was in a gathering of friends. I was the only doctor. In fact, I was the only person who kind of makes a priority out of evidence-based medicine rather than going to a naturopath. And someone was talking about their experience with the stem cell therapy came up, but it was prolotherapy was the main thing. And they did touch on the PRP too. And somebody was talking about their great experience with prolotherapy. I had not read the literature in quite a while about studies done on prolotherapy. And so in my mind, I was just associating it with people not in medicine, with the naturopath or the chiropractor, whoever it is that's doing it out there, not with medical training. And they were talking about how they had great improvement with it. And I thought, okay, take a note. This is somebody's experience that goes against what I thought was... And my experience prior to that was a patient who had seen me for his hip.
Oh, I remember the story.
Did you see the x-rays? Did I ever show them to you?
You did show them to me.
And we had started some physical therapy, I believe. And then he'd had prolotherapy and came back. And so within a period, do you remember how many months it was?
Oh, it was quick.
It was a short time, like 6 months. Yeah. So we had before and after x-rays, and we saw horribly advanced arthritis.
Yeah, progression you would normally see over.
Yeah, like
years.
Something happened.
Yeah.
And the only thing that happened in that joint that we knew of was prolotherapy by somebody who wasn't a physician. And so that really colored my concept of what prolotherapy is and what it does. So let's go to the literature. So let's start with prolotherapy.
Yeah. So we did PRP, we're on prolotherapy. Let's talk about that.
If you have a particular joint you want to know, you can put it in Super Chat for that. If you have something you want to talk about with PRP or stem cell, you can do that. Okay, so let's go to then you're going to join us on this journey. You're going to watch us in real time look at what...
Did you explain what prolotherapy was?
No. So prolotherapy is the injection of a dextrose concentrate. So it's essentially water and sugar.
Yep.
What could be closer to a sugar pill?
Or a placebo? It's like literally a sugar.
Do you see why I have a hard time getting on board with this? When a sugar pill is what we use to see what happens if you don't give somebody a treatment in a study. Okay, so let's go to the literature here.
When it comes to injections, instead of a sugar pill like they do for pill studies, it's actually usually a saline injection as the
we should
sham.
Probably make sure they can still hear us when we're looking at this after that experience. Yes, they can. Okay. I guess you need to know what I asked for. My question was knee osteoarthritis, tennis elbow, plantar fasciitis, hip osteoarthritis, shoulder rotator cuff injury, or lateral epicondylitis, also known as tennis elbow. Okay, demonstrates efficacy or it's effective for several of these conditions with the strongest evidence supporting its use in knee osteoarthritis and tennis elbow. Moderate evidence for plantar fasciitis and emerging but less robust evidence for rotator cuff injury and hip osteoarthritis. We should probably stop there. So you heard that as a layperson. Now, we as doctors, when we read that, we may read that differently than somebody who doesn't have medical training and isn't familiar with medical literature. How would that be?
I don't know where we're getting with this, but I'd want to.
Yeah, what are your thoughts? We want them to hear our thought process and see it in real time.
Yeah, so you'd want to know. So it says moderate evidence with the strongest evidence. You want to know a little bit more about those studies because not all studies are created equal. Anyways, this expands our ability to trust data.
All right, let's jump back into. What I was going to say is the strongest evidence. It says strongest evidence is for the knee arthritis.
Right. So does that mean the strongest evidence is that it gives you a big
compared against?
Yeah. Strong. I guess that's what does that mean? That needs to be looked into a little more carefully because strongest evidence. Okay, the evidence is very strong that you get a 1 point improvement on a 100-point scale.
Yeah.
Let's go on.
All right. So and then also moderate and less robust.
Right. Yeah, and this is always the difficulty when looking at some of these, like especially open evidence and other things. You've got to keep reading.
So if you were to have a procedure done to your body,
go back to live chat.
Yeah, back to the live chat. So going back to reading this with you.
Let's keep reading.
There it is. For knee osteoarthritis, there's multiple systematic reviews and meta-analyses show that prolotherapy provides significant pain relief and functional improvement compared to exercise alone and placebo, with benefits sustained in the medium to long term. And we know that kind of language really puts it up there with the cortisone shots that we give and hyaluronic acid injections. Right. Do you know another name for that we can share with the audience?
Name brands, Orthovis, Synvisc.
Synvisc, there you go.
Are the common ones.
So it's sounding like that, and I didn't put in the question to compare it against cortisone shots, but
it's still.
But we can.
I think it said,
Last time we did this, I know I said I erased my memory, but last time I do remember it saying that it was competitive with cortisone shots.
Yep.
Without the side effects of steroids.
Which can be significant.
And that's from a couple of studies here. Let me show that we are actually checking references here. When I look at this, it says there's 3 references. One of them is in Scientific Reports 2016, never heard of it. Journal of Rehabilitation Medicine 2023, never heard of it. British Medical Bulletin 2017, haven't heard specifically of that. So, not sure what to think of that.
More specialized journals or journals that are not mainstream, but maybe utilized in other.
It wasn't Nature.
Yeah, or New England Journal of Medicine.
It wasn't JAMA,
BMJ.
Wasn't The Lancet. But with something like this, even if it was super, super, super good, would it have a chance of getting published in those journals?
Not necessarily, because it is still not.
It's just musculoskeletal pain, and it may not reach the level of the significance that the editors of those journals are looking for. So I hope you're getting a little bit of an idea of how we look at it. Okay, let's move on since we haven't had anybody say something else yet, at least not that I've seen. For lateral epicondylitis or tennis elbow, prolotherapy demonstrates superior outcomes compared to active controls. I don't know what active controls means.
I don't know what that means either. Active controls.
A 2022 meta-analysis found that, meta-analysis being where you get lots of studies and compare lots of studies about the same treatment. Not all the studies are done the same way, so you may not be
sometimes hard to compare them.
Found that prolotherapy reduced pain intensity, SMD minus 0.44.
Hey, there's my
standard
journal, the American Academy of Family Physician. That's my academy.
Okay. And improved function, mean difference minus 15.04 on DASH scores at 12 weeks, with benefits meeting criteria for clinical. Oh, that's interesting. The term clinical relevance. So that jumps out at me because usually we're talking about statistical significance.
Right.
And this said clinical relevance. What's that mean to you?
That means that they were probably looking at scores that patients had in like an office or in a clinical setting as far as pain relief or function improvement. So that's a little more than just, if something meets statistical.
Well, anything
analyses.
is going to be based on a patient report because it's going to be about pain.
Yeah,
It's gonna be on
but
something
clinical
scale.
relevance means this is actually something you can bring into your office, and actually, it is a slightly different criteria in the American Academy of Family Physicians. We often talk about these studies. Can we bring this into our office? And this is something that is relevant to our practices, and that's something.
That is something.
It can.
That is something. So I feel really good about that, for that to be coming from AAFP, because as a family physician, I have respect
Outperform the
for that.
ceiling.
So that's cool. Okay, so that's knee osteoarthritis, tennis elbow.
Yep.
A 2025 randomized control trial with 2-year follow-up showed prolotherapy yielded greater DASH score improvement, 21 points, compared to physiotherapy or physical therapy, 18.7. Now, again, I'm not
What's the
familiar with the
scale for
scale.
that? Yeah.
I don't know what a DASH score is, but when we see that, it says it's better, but then you see the difference was
3 points.
18 to 21.
Yeah. I'm 2.5 points.
And we don't know how powerful that study was. Okay.
Right.
Which one are we going to do next? Did somebody say which one they want us to do next?
No. Come.
Nope, nobody said. Okay, so we will move on.
But we'll keep going on prolotherapy.
Okay, on prolotherapy. Oh, shoulder rotator cuff. Let's show this to you so you can see what we're looking at here. The evidence is less consistent.
Less consistent.
While multi-site enthesis injection protocols, that's what they're referring to with the disease of the tendon, we'll call it, showed statistically significant pain improvement compared to physical therapy, ultrasound-guided supraspinatus injection trials did not demonstrate significant differences compared to control. Okay, we need to unpack that. So what they're doing is comparing it to when somebody uses ultrasound to guide the needle to the right spot.
So you're in the right place.
And the supraspinatus is where most of this problem occurs. That's the tendon where
common
most rotator cuff
cuff.
problems are occurring. Our injections are not into the supraspinatus tendon; they're into a bursa nearby.
Yeah. So it
Showed statistically significant pain improvement compared to physical therapy.
did not. Yeah. It's essentially the takeaway is not really helpful.
Don't get prolotherapy in your shoulder.
Are we? Should we be grading these? Thumbs up, thumbs down. This one's a thumbs down.
Both Roger and Ebert are saying thumbs
Do
down
not get
on shoulder.
prolotherapy.
Don't get prolotherapy in your shoulder. Don't let somebody talk you into it. Do not give them money for it.
These are, and here's the other consideration for these types of injections. These are not typically covered by insurance. I don't believe insurance is on board with a lot of these.
If you were
Again, because
minding
the
till for
data-
insurance company, would you?
Yeah, because the data is not. But even probably for the knee and tennis elbow, I don't think they kind of make generalized.
For hip osteoarthritis, the available literature is limited.
That means more studies. I would not do something.
You
if
can tell
it's
your
on the
mother or
bench.
father to get it.
Not based on that.
Who would you rather have?
Yeah, there you go. Well, and get good recommendations, trustworthy recommendations based on data.
Yeah.
We pride ourselves as evidence-based medical doctors.
So we look forward to future shows that could get preempted by something in the news.
Yeah,
But right
Maybe
now
next
it
week
looks
we'll
like
talk about
our
the
future
evidence.
shows are going to be about the evidence of PRP for joint injections,
excellent.
but also for the tendonitis, and also stem cell therapy. So be looking out for
Should
both
we
of
maybe
those.
even do one on chiropractic and the
that's a
data
thing by
behind
itself.
that? That is completely separate from this. It's not an injection,
That could
but
be
hey,
one too. So
we can do.
let us
if
know.
if you want that. Let
at
us
this
know.
point, I have to be in the comments what you want to learn about. Until next time,
I'm Dr. Wayne Bond.
Dr. Mark Vaughn telling you to stay in good health.